Hi, I'm Dr. Reese, and I want to go over the key aspects of using your equipment to have a successful telemedicine visit. First of all, set up an appropriate professional background. Whatever you do in the office, you would want to do in a telemedicine visit. Make sure that you're also setting a professional background, whether this be a white wall, maybe a picture, maybe something like a bookshelf, something that's not distracting and moving where the patient would be looking behind you instead of focusing on you and the visit. Most importantly, make sure that you are in a safe, private location and make sure that the patient is as well. These are confidential visits. We want to make sure that the patient is not driving, is not in a public location. Same thing with you. Make sure you are both in a private, safe environment and definitely confirm that before the visit. Also make sure your face is framed in the middle of the camera. You don't want to be too close to the camera. You don't want to be too far away from the camera. You don't want to be off camera. It's always good to check this before you have the visit, and that way you're not moving the camera around while you're getting oriented to the patient and starting the visit. About 2 feet away from the camera is probably the best place to be, and that frames your face nicely and is an appropriate distance when doing a telemedicine visit. The next aspect is eye contact. Eye contact is very important in a telemedicine visit because it is how you build rapport with the patient. You should make eye contact with the patient in a telemedicine visit the same as you would in a face-to-face visit. It's a little tricky in a telemedicine visit. To make good eye contact during a telemedicine visit, you actually have to look at the lens of the camera. If you are looking at the patient on the screen, that is not making eye contact with the patient, and the patient feels like you're actually looking down. So if you look at the lens of the camera, whether it be a laptop, a phone, whatever it is that you're doing the visit on, then that makes good eye contact with the patient. The next thing is if you do have to break eye contact with the patient, let them know. A lot of times when I'm doing a visit, I want to review a lab or I want to review some imaging, and I will tell the patient, I'm going to look away from the screen a little bit while I'm reviewing these things. I'm listening to you. I just want to make sure that you know that I'm looking over here from some data. And patients appreciate that, knowing that you are focused on them and the interaction, and then come right back and make eye contact with that patient again as you're telling them about the data and the things that you looked away to discover. Before starting the visit, it's a good idea to discuss the format with your preceptor. You might be in a separate room as your preceptor. You might be observing with your preceptor. You might be on the same call as your preceptor. There are a lot of different ways to doing a successful telemedical visit, but just make sure that you work that out beforehand. And that way it doesn't feel artificial or rushed when you're in the patient scenario. When you do connect with the patient and you start the visit, it's always good to do an audio and a video check. I always say, Mr. Smith, this is Dr. Reese. Can you hear and see me okay? Also make sure, again, that the patient is in a safe and private environment. You don't want to do a telemedicine visit if a patient is driving, if there are others in the room, if they're in a public space. Make sure that they are in a safe and private environment as you are before you start the visit. The next part of the visit is very important. It's about informed consent, and it is something that is often forgotten during a telemedicine visit, but is something that is very vital to do and something that you will likely see again in some of your standardized visits and also in your clinical encounters. It's not just consent, it's informed consent. After you confirm the patient's identity and that they are located within the state of Indiana, I always start with a statement such as, tell me what you know about telemedicine and how it can benefit you. That gives them the opportunity to talk about the benefits of telemedicine. They didn't have to drive into this doctor's appointment to see you. It's very convenient. Also, there are some limitations to telemedicine, and that lets you explore those with that patient. You might not be able to do certain exam maneuvers, and so that way the patient is well informed about the pros and cons of telemedicine. Let the patient know that the visit is private and you're in a secure private location. Also let them know that they can stop anytime if they feel uncomfortable or you feel that a face-to-face exam would be necessary. After informing the patient about the telemedicine visit, obtain their consent for the visit and then document that in your note. Now you've learned how to set the stage for a successful telemedicine visit. Remember the following things. Check with your preceptor first. Make sure you understand the format of the visit and that you're comfortable moving forward. Make sure your equipment works. Make sure to check with your patient that they can hear and see you. Make sure that you're in a private and secure space. Make sure the patient is as well. And make sure that you obtain and document informed consent prior to the visit. Watch the next video for a demonstration of a successful telemedicine visit.